Good morning, everyone. My name is Alirio deMeireles. I'm a third-year medical student, actually, at the University of Michigan, and thank you for having me. So today I'd like to talk to you about the BodyQ survey. It's a new bariatric-specific patient-reported outcomes measure. So I have nothing to disclose. So broadly speaking, patient-reported outcomes, or PROs, are really any report on the health status of a patient that is filled out by the patient themselves. PROs aim to answer the broad questions on the slide and augment the traditional outcomes measures that we are used to, the clinical objective measures like readmission rate, mortality rate, and rate of serious complications. And I say augment because these traditional objective measures can have several shortcomings. And an example of where these traditional measures fail was highlighted in a recent New York Times article which chronicled the stories of two bariatric patients who were getting surgery at the University of Michigan. And by all traditional clinical outcomes, the surgeries were great successes, but when asked about their thoughts on the surgery, the results were pretty lukewarm. And I think that this disparity between the clinical and the patient's own point of view really highlights the importance of PROs. So why are PROs important? So in 2004, the Department of Health and Human Services created what's known as the patient-reported outcomes measurement information systems. And they invested a lot of time and money into this, and despite not knowing about what's in the future of the potentially volatile healthcare climate, I think everyone can agree that value-based healthcare is here to stay, and PROs make up an important part of value-based healthcare. So currently, the PRO landscape is a little bit like this eggshell. The 68 different fragments of this eggshell represent the 68 different PROs that are in the bariatric literature alone. Now, what's more is that pretty much all of these PROs were not designed specifically for the bariatric patient population. And if you were to ask our patient, would you like this thing that is meant just for you or a generic form, I think the answer there would be easy. And the easy comparison would be clothing. If I were to offer you an off-the-rack size medium suit versus some beautiful bespoke suit, I think the answer there would be pretty simple. And I think that is a similar option that we should give to our patients. But what is the answer? How do we find this golden egg? Well, that's where the BodyQ survey comes in. So the BodyQ survey is it measures how patients perceive their weight loss, and it does so over 3 domains. So appearance, health-related quality of life, and experience in healthcare. And it's the first PRO measure that was designed specifically for and validated in the bariatric population. And it does this over 18 different independently functioning scales. So here's a quick snapshot of the 18 potential scales that you can use. And for our study, we chose to look at body image and psychological well-being. And what we did was we took those 2 scales and we administered those 2 surveys to 2 cohorts, pre-bariatric and 1 year post-bariatric. And we looked at the survey results and linked them to prospectively collected data from the Michigan Bariatric Surgical Collaborative and assessed for any associations between clinical characteristics and patient demographics. And here's what we found. There's a lot going on the slide here, so bear with me while I break it down. So for each of the 4 patient results, we broke the scores into terciles. So right now you're looking at pre-op body image. And as you can see, for pre-op body image, black race was associated with higher pre-op body image scores. So for post-op body image, we found that male gender and low BMI and high percent excess body weight loss were also associated with higher scores. For pre-op psych well-being, we found that male gender and black race were associated with higher scores. And similarly, for post-op psych well-being, we found that male gender, black race, lower BMI, and higher percent excess body weight loss were associated with higher scores. Now, the next few slides are irrespective of patient demographics and terciles, and really just show that there's an increase in the mean score between the pre and the post scoring. So for pre-op, we're at 12.08. Post-op, we shift to about 20. And for pre-op psych, we're about 32. Post-op, shift to about 34. And it's important to note here, and I want to point out that the increase in body image score is not proportional to the increase in psych well-being. So just because someone's body image improves does not mean that their psych well-being necessarily improves proportionally. And here's a quick snapshot of just the patient characteristics that we found were associated with higher scores. So this leads us to conclude that there are large variations in body image and psych well-being in patients before and after bariatric surgery, and that there are several patient-level factors associated with lower scores. But what are the implications of those? What are the implications of those findings? Well, I would hope that you take the, I would hope that you take the less obvious associations and use those to provide targeted counseling in the pre-op and post-op environment. And on a more macroscopic scale, I think we found our golden egg here. And if we use the body Q as the national standard PRO for bariatric surgery, we can kind of make these aggregate epidemiological level studies and tease out some psychosocial factors that affect bariatric outcomes. And that's all I have. I'd be happy to take questions, but I want to thank the team at Michigan, especially Dr. Ghaffari.
So just one quick question. So some of the things that you reported that were positive were obviously not modifiable, like race and gender. So how do you, you mentioned that you can adjust counseling based on some of the findings. How do you think that your providers can adjust their counseling?
Well, given the patient demographics that were associated with higher or lower scores, you can identify in the preoperative setting who is more likely or less likely to need counseling and give recommendations as such.
Thank you.